Welcome to DeSera Clinical Education's Infectious Diseases Podcast. I'm your host, Dr. Karen Straube West. In today's episode, Bright Ansah, Patient Advocate, shares his personal experience with being diagnosed with chronic hepatitis B as a recent immigrant to the U.S. and describes the unique barriers to treatment faced by the African immigrant community. To view the full educational program, please visit the show notes for this episode. Now let's get started.
Over a decade ago, I incidentally found out that I had been living with chronic hepatitis B. At the time, I was shocked and felt sorry for myself. As an immigrant in a new country with no family support, these were among the most challenging times of my life. My diagnosis changed me as a person. Every immigrant comes to America with big dreams of working hard, earning a living, attending school, and supporting their families. My diagnosis robbed me of some of these dreams. When someone is diagnosed, no one explains to them about the negative things they may experience. There is no manual or a book to read to understand what we are to expect as hepatitis B patients. Some barriers that impacts patients are language barriers. In the African immigrant community, English is a second language for many. For some patients, being in America is the first time they have ever spoken English. They now have to navigate a new country and a new language different from what they know and understand. This becomes a barrier for many community members seeking care and treatment. Patients in this community face steep language challenges, which cause some to stop seeking care or drop out of care. Additionally, speaking a language is one thing, comprehending it is another. The use of medical jargon instead of plain language creates an extra barrier. Some patients are unable to understand what is being said or asked. I was lucky because I was fluent in English before immigrating to the US. So while I struggled at times to comprehend American English, it was not as difficult as what some other African immigrants go through. Another barrier is difficulty navigating the healthcare system. Lack of health insurance is another barrier for this population. I lost my insurance after my diagnosis, so I went almost 2 years without insurance, medical care, or follow-up. This could have ended badly for me if my condition had changed or worsened. There was no way to catch it. My experience is similar to that of some patients in the African immigrant community. They do not seek care and treatment because they have no health insurance and no means to pay for care out of pocket, which can be costly. Navigating the U.S. healthcare system is challenging for many native-born Americans. Imagine how difficult it can be for someone who barely speaks or understands English and knows little about the complexity of the nation's healthcare system. This poses a challenge for many hepatitis B patients in the African immigrant community. Even when access to care is not an issue, there is distrust of Western medicine among some in this community. This distrust stems from past experiences and history. It also stems from denigrating commentary in the West regarding traditional African medicine. Some Africans seek traditional care for almost all their healthcare problems or needs, and being presented with something different can be difficult to accept. Many Africans will try traditional medicine first before seeking Western treatment for an ailment. This is because that is all they have known and is part of our culture and upbringing. We are exposed to this as children. This is something that community members consider when deciding whether to seek treatment and care. There are some myths and misconceptions about hepatitis B in the African immigrant community, which stems from the misunderstanding surrounding hepatitis B that contribute to stigma. Some people believe that because hepatitis B can be transmitted sexually, it means patients living with the disease might have been promiscuous. This is inaccurate. While hepatitis B can be transmitted sexually, the majority of patients become infected at birth or via vertical transmission. Another misconception is that anyone with hepatitis B is either cursed or punished by God for their sins or the evil acts they may have committed. This is also inaccurate. Some people are not concerned with preventing hepatitis B infection or seeking treatment early because they believe it can be cured. Patients are not cured because they are on treatment. This is another misconception about hepatitis B. Myths and misconceptions about hepatitis B stem from misunderstanding, misinformation, and negative perceptions about the disease. Increased education and awareness will help dispel some of the myths and misconceptions about hepatitis B. Some patients and providers do not understand the serious health problems that hepatitis B poses. This is reflected in a lack of insight into which tests providers must order or how to interpret the results. When I was diagnosed, I had only basic knowledge of the virus that causes the disease. I took time to research and learn as much as I could. This was helpful because it reduced my anxiety and depression as I became aware of what hepatitis B can do if left unmanaged. I have taken this disease seriously, which has led to my adherence to care. In people who lack this knowledge and understanding, adherence to care can falter, and falling out of treatment and care can result. This leads to worse health outcomes for patients. Living with hepatitis B is difficult, and navigating some of these barriers makes seeking treatment and care extremely challenging. We must find ways to reduce these barriers for patients in the African immigrant community.
Thank you, Bright, and many thanks to you, our listeners, for joining us. To view the full program, please click the link in the show notes. To get access to all of our new podcasts, subscribe to the DeSera Clinical Education podcast on Apple Podcasts, Google Podcasts, or Spotify. Thank you, and have a great day.